Does it hurt for you to raise your arm up? Do you have difficulty getting your hand in an overhead position? If so, you may be dealing with a rotator cuff problem. My name's Matt Davis. I'm an orthopedic surgeon, and in the next few minutes, I want to go over with you one of the most common problems that I see in my office, and that is a rotator cuff issue. Now, there are two major categories of rotator cuff problems that I see. One is just simply inflammation, what we call tendonitis or bursitis. And then the second is an actual tear of the rotator cuff. So before I get into that, let me go over a quick little anatomy lesson so you'll kind of understand what we're talking about. The shoulder is made up of three major bones. One is the shoulder blade that sits on the back of your torso, then your collarbone, and these connect right here at the top. That's what we call the AC joint. And then your arm makes up the third bone. Now, what connects all of these pieces together is the muscles and tendons that make up the rotator cuff. Now, we'll trade out this model for one that just has the bones and muscles and tendons, and you can see that the muscles lie on the back side. There's some low on the back side, and then there's another one that's high on the back side, and then there's another one that lies on the front of the shoulder blade. So that would be between your shoulder blade and your ribs on the back side of your body. So the rotator cuff muscles are what actually give you a lot of the power to elevate your arm and to rotate it like this. So when you have a problem involving your rotator cuff, it can affect any or all of those movements. Now, only certain muscles and certain tendons are involved in specific movements. So sometimes a certain movement may be perfectly fine and you don't have any trouble, and then another movement is very painful and you feel weak doing that. That may be because only one or two of the tendons is involved and not all of them. The real problem that we see is that because of the shape of the bones in the shoulder, and if we look a little bit closer at this model, I'm going to turn this around because I think you can see it better from the backside. The space between this, what we call the roof of the shoulder, and the ball is occupied by the tendons. But as you raise your arm up into an elevated position, that space narrows. This gap gets smaller, and so the tendons can get pinched in that space. And that can cause a lot of pain, and eventually, over time, it can lead to a tear. So what do we do as orthopedic surgeons to treat this sort of problem? Well, first and foremost, it's to diagnose the problem correctly. There are a lot of things in the shoulder that can cause pain, and if you don't know what's causing the pain, then the treatment sometimes isn't very successful. So first and foremost is identifying and correctly diagnosing the problem. The second thing that we implement are strategies to try to minimize the pain and to restore function. So if the problem is inflammation, then an anti-inflammatory typically can help. Sometimes that can be in the form of a pill, whether that's something over the counter or a prescription, or sometimes it's in the form of an injection, medication that we put in the shoulder itself. The second thing is to restore function, and that usually involves some sort of exercise. That can be a home exercise program, or it can mean going to physical therapy to work with a physical therapist that can help you do the exercises properly and to focus on the exercises that are going to make the most difference for you. If those are not effective, the medication and the exercises don't work over a period of several weeks, then sometimes we need to investigate the problem further and see if there's actual structural damage, i.e. a tear in the shoulder, and sometimes that ends up requiring surgery in order to eliminate the problem. So if you're having trouble with overhead use, it may be your rotator cuff. Try taking some anti-inflammatories to see if that makes a difference. You can look up online some exercises that might be helpful for your rotator cuff. Do those on your own. If you're not getting relief, it's worth going in to see somebody. I'm happy to see you if you live in the Birmingham area. My office is Davis Orthopedics. If we can help, please give us a call.